The fungal infections of the skin could be classified into three classes: the superficial fungal infections, deep fungal infections, and systemic fungal infections. Under superficial fungal infections, we have dermatophyte infections, Pityriasis versicolor, candidiasis. Under deep fungal infections, there are mycetoma, sporotrichosis, and chromoblastomycosis. And in the systemic fungal infections, there is histoplasmosis. And in this video, we'll be specially focusing on Pityriasis versicolor, which is a form of superficial fungal infections. The etiological agents of Pityriasis versicolor are the fungus Malassezia globosa and Malassezia furfur. Malassezia globosa is more common than the furfur. They usually target the hair follicles, classically causing perifollicular scaly macules as shown in this picture. As the nomenclature suggests, pityriasis means scaly and versicolor means variety of color. So what this means is that if we go into the clinical features, the lesions could either be hyperpigmented or hypopigmented, and they will be finely scaling, circular or oval, macules or patches in the areas of scalp, face, neck, chest and back. The scales can be defined as fine or briny or furfuraceous scales. So in this picture there is hyperpigmentation, and here you can see there is hypopigmentation. In the color of the skin, the hypopigmented lesions are because of an acid produced by the fungus which is called as acylic acid. The acylic acid will inhibit the enzyme tyrosinase, resulting in hypopigmentation. And the hyperpigmented lesions are due to induction of large melanosomes by the fungus. There is an important clinical sign of pityriasis versicolor called as Besnier sign or Coupe de Angle sign. At first, the scales of pityriasis versicolor are not very prominent, but when you scratch them with the nails or a glass slide, the scales will become prominent like this. So this sign is known as Besnier sign or Coupe de Angle sign, and is one of the clinical signs of pityriasis versicolor. Now coming on to the investigations. The investigation of choice is KOH mount, and the reason why we do KOH mount is that if we take the lesion directly into the microscope and watch it, then we won't be able to see anything because our vision will be blocked by keratin. So the KOH mount will dissolve this keratin, and thus we can visualize the fungal filaments better. In the KOH mount, the findings will be short hyphae plus round spores like here. So these are the short hyphae and here are the round spores, giving it a classical spaghetti and meatball appearance. So you can compare these two pictures. The round spores correspond to the meatballs and the short hyphae correspond to the spaghetti. The next investigation we can do is Wood's lamp investigation. It is done with the wavelength of 360 to 364 nanometer, where we'll get yellow fluorescence. Now before going on to the treatment section, let's briefly discuss about the differential diagnosis. The first one is vitiligo. In vitiligo, there is actually depigmentation, whereas in pityriasis versicolor, there is hypopigmentation. So in pityriasis versicolor, there is at least some amount of pigmentation left, which is less than normal, but in vitiligo there is no pigmentation at all, which is called as depigmentation. There are no scales in vitiligo, whereas there are fine, briny or furfuraceous scales in pityriasis versicolor. The next is leprosy. Leprosy also has hypopigmented lesions, but these lesions are usually plaques or nodules, whereas in pityriasis versicolor, the lesions are always macules. The scalings are usually seen in subsiding reaction only in the case of leprosy, whereas in pityriasis versicolor, there are always scales which are seen in perifollicular macules. There is loss of sensations in leprosy as the knobs are affected, whereas in pityriasis versicolor, the sensations are preserved. The hair may be lost in leprosy, the hairs are preserved in pityriasis versicolor. Now finally onto the treatment section. The treatment we use are antifungals called azoles, which includes ketoconazole and clotrimazole. Then we can also give selenium sulfide, which is available in the form of shampoo or lotion. And the selenium sulfide has both fungostatic and cytostatic action. So that's it for Pityriasis versicolor. Thank you.